The 4th annual UCSF Digital Health Awards seeks to find the most impactful and disruptive digital health companies. Out of thousands of participating companies, only the top 4 in each category are selected as finalists.
It's a long road to become a surgeon, and there's too much to learn, so you're being spread too thin. It takes about 50 to 100 procedures to achieve basic proficiency. You're relying on random chance to get exposure to those surgeries. With virtual reality, you go from having one tibia to infinite tibias, right? You can get those reps in. You can use it anytime, anywhere. You can train on any procedure. You can train as a team and train remotely. With Osso VR, our mission is to improve patient outcomes and make providers' lives better. It's not replacing real-world experience, but it's enough to get you much further along the learning curve so that when you walk into the operating room, you feel very confident and you know exactly what to do. The Oculus team is so excited and supportive of the work we're trying to do in the world. I can feel it, and it is highly motivating. You can create technology that can impact the lives of billions of patients all around the world. Virtual reality and the Oculus Quest is one of those technologies.
Hear in their own words why they should win.
My name is Justin Broad. I am a former game developer turned orthopedic surgeon and co-founder and CEO of Osso VR. Osso VR is the world's largest VR healthcare company. We have over 209 employees and have raised $109 million in venture capital financing. Osso has been a proud participant in the VR Awards for a number of years and the previous winner of the Best in Healthcare category last year, which we're really excited. But this year, things are getting really crazy here at Osso. I think what I'm most excited about of our newer modules that we're releasing is the clinical validation that we're performing. Osso VR has been proven to be effective in 6 published peer-reviewed clinical studies, the most recent of which was performed at Johns Hopkins, where they compared training in Osso VR with cutaneous haptic feedback and off-the-shelf VR technology with MetaQuest 2 with a fully physical force feedback model. What they found in that study is there was no difference in skill transfer between training with a roughly $30,000 to $40,000 setup with force feedback and training on Osso VR on a $300 headset. So what this means is that a $300 piece of technology is as effective as the most sophisticated force feedback equipment when it comes to skill transfer. This means that we have the opportunity to get high quality, effective surgical training to every single healthcare professional in the world. There are 1.1 million surgeons around the world, 310 million procedures performed annually. And our data shows that Osso VR can improve performance anywhere from 230 to 300% in published studies, which is insane. We also boast the world's largest surgical training library with over 200 modules in almost every surgical specialty. Thank you so much for your consideration of Osso VR. I think what we're doing here is very different than other aspects of VR in healthcare or VR training, partially because of the scale, the clinical validation, and the success as a company that we've clearly had.
Join us on November 14th for our grand finale at Health in Las Vegas to see the winners crowned.